Okay. So good morning, good afternoon, and good evening to everyone. I am very happy to be your chairperson this morning, and we have an excellent and very, very important program. So, of course, you know already, the people online, that it is estimated that 400 children develop cancer every year. And in 2021, St. Jude's Research Children's Hospital and WHO launched a very important initiative. So this was the global platform. And this comes from an analysis that if we really need to do something that is a game changer, it would be to give access to medicines to children. So since then, St. Jude's and WHO has worked together, and St. Jude's has committed a 6-year investment to launch the global platform in partnership with WHO. And you will learn today many things about that when we listen to several of the speakers. I hope we'll also be able to give some perspectives on how partners can contribute and also engage in the platform. So I'm very happy to introduce the first speaker today, and this is a person that is known probably to most of you already, and it's a real pleasure to introduce 2 seconds. I just had some technical glitches here. Let me see. The opening address, and this is coming from President of the International Society of Pediatric Oncology. So it is my honor and my pleasure to introduce Guillermo Chantada, and the floor is yours.
Thank you very much, Bente, dear friends. Well, it's just such a pleasure for SIOP to be present in this forum. SIOP is actively participating in the platform, as Bente mentioned, and also has a very active discussion group on essential medicines, whose members are going to be the presenters in this forum. So for SIOP, this is really a priority. The list of the drugs that should be accessible for all the countries need to be improved continuously. New indications come, and not just new indications or new drugs. It's the way we can apply these drugs in low and middle income countries in many times is not the same as we would do in high income countries. We have different issues, we have different challenges in our setting. The treatment-related mortality is very important. So some drugs that have been used in high-income countries for some indications need to be redefined and rethought in low and middle-income countries, but with also having in mind that treatment-related mortality is one of our most important issues to deal with. So any improvements that we can make, figuring out how to use these drugs is really essential. And these are the forums where we can really make that happen. SIOP is also supporting in association with Resonance and Servier. We are working on the Act for Children program where, it's going to be described later in detail, but it is also a very important project for SIOP in order to enable the access to essential drugs for children with acute lymphoblastic leukemia. So again, a real pleasure, a real honor for SIOP. Thanks OncoDaily for organizing this very important event, and looking forward to a lot of very fruitful discussions.
Thank you very much. And without partners like SIOP and CCI and others, it will never be a real implementation on the ground. So I'm extremely happy to see you. And also thank you for mentioning the focus on low and middle income countries. As we know, there are huge discrepancies, and this is exactly what we want to achieve at the platform, to have a survival rate that is above 60% for all children. So thank you very much.